We were all teenagers. We may have made perhaps bad decisions or mistakes during that period of our lives. And in a very serious way, many of those decisions may have been influenced by our peers. And what we didn't know 20 years ago that we now know through a lot of the extensive brain research that has gone on is that that is a very critical point of adolescent development. There's a lot that we know, not just about the science of the brain, but what we also know about what can happen in terms of the evidence-based tools that are available from that first point of contact that can really help systems assess what is the most appropriate response. And that's important for a lot of reasons. One, it's an efficiency argument that you're dealing with the most serious people first. It's also, in this climate, one to think about in terms of cost, but it's also one that really speaks to fundamental fairness. And, what is the appropriate consequence or proportionality of what the system should do in response to a different type of behavior.
So basically a risk assessment tool helps us categorize kids, helps us kind of screen out people who are unlikely to engage in any further delinquent behavior, and helps us focus on the youth who are likely to keep offending so that we can help intervene and prevent that from happening. So it's not enough to just tell me that somebody's high risk. I need to know what to do with that. My job is to prevent it from happening, not just to find out that they're high risk. So our job is to prevent them from reoffending again. And different kids come into the system with kind of unique circumstances that got them there. And so our goal is to help put those services in place that are going to reduce their offending in the future. If we use the right evidence-based tool in the right place with the right youth in the right way, these tools can really lead to conserving resources, conserving costs, and having better outcomes for kids. We've found in states that have implemented these well, they've cut their placement rates in half, they've cut the amount of supervision that they need to give to kids, they've cut their service use and reallocated it so high-risk kids get more, low-risk kids get less. This is all cost savings. There was no increase in recidivism after they did all of this. So this was without any cost to public safety.
There is a broad recognition, even among law enforcement leaders, that there's a large proportion of young people that they come into contact with who have made mistakes, who have broken the law, but where arrest and prosecution and putting them through the official system is not going to be the best outcome. Sometimes there have been real barriers in terms of trust between law enforcement and other actors in the juvenile justice system that can really inhibit the ability to build those systems for diversion and for alternatives to arrest. And, I think there is a growing interest and awareness among the law enforcement community for the importance of trying to increasingly do things differently, and also an awareness that law enforcement can be thoughtful partners in these issues and are not just in a lock-em-up mentality.
If in Miami-Dade County we were only looking at charges, we would completely miss the boat. We would completely forget about the importance of addressing the root causes of why kids are coming into the system and really preventing them from future delinquency. Our protocols have really focused on 3 areas. We've looked at what are the service needs of children in the mental health area, substance abuse, as well as family. I think that Miami-Dade County has been so successful because of the type of work that folks like Kate and her organization does. I think that our most important role has been bringing law enforcement to the table and really finding alternatives to arrest. You can't tell a police officer, you know what, I know that child has behavioral issues, but don't arrest, and not give them the resources that they need. Since 1997, we've been able to reduce the juvenile arrest population by 72%. We've been able to reduce the juvenile detention population from 300 children a day to less than 70 kids a day. And through all of these innovative programmings, we've been able to generate a $33 million gross systemic savings annually.
For the young people who fall into a category where they did one dumb thing and they're not going to do it again, you've now diverted them out, and they'll have a whole different trajectory in terms of what they can contribute as a productive member of society.